We're joined with Dr. Choi of Choi Orthodontics and have a lot of questions. So thank you for joining us, Dr. Choi.
Thank you. It's good to be here.
I'll start with your background. What inspired you toward orthodontics?
I get that question a lot. I had a fascination with working with my hands and a deep appreciation for medical knowledge. And so dentistry offered the opportunity to be able to combine the two together.
You have a strong conviction about orthodontics. Why do you feel it's so important?
Orthodontics is important for many things. It's one of the first things that people notice in terms of impressions. It's important for periodontal health, where you can easily cleanse and keep your teeth clean. But more so, it actually contributes to your overall health and well-being. It can contribute to diabetes, lead to some heart problems, premature low-term weight babies, among many other things.
Wow, I've been reading about that. I also saw the term malocclusion on your website. Can you tell me a little bit about that?
If we're to break down the two words together, mal means bad, occlusion means bite. So you put the two words together, and what that means is there's a bad bite.
Why is it important to have a good bite?
It's important to have a good bite for a number of reasons. One that's very obvious is going to be it affects our self-esteem and perception of people when we smile. We never really get a second chance to make a first impression, and research shows that smiles are actually the first thing that people look at next to the eyes. A second very important thing is going to be the health. When we have straight teeth, we're actually able to keep our teeth cleaner and healthier and prevent us from going down that road of periodontal disease.
What are some of the things you consider when seeing a new patient for their initial consultation?
I take into factor every part of the individual, because every person is different, and so I want to make sure that I individualize and personalize treatment for each individual. We take a set of models, impressions, x-rays, photographs, and I'm looking at the soft tissue profile, I'm looking at the skeletal structures, and I'm also looking at their teeth. And most importantly, I want to address their chief concern about their smile.
Talk about the importance of using a person's natural teeth as opposed to some kind of cosmetic solution.
As orthodontists, we are tooth movers, and my goal here is always to try to use your natural teeth. There is nothing better here than to use the patient's own natural dentition to get the teeth straight. Veneers are also very good options, but it is just a camouflage treatment here, where we're not really addressing the underlying issues, which can still lead to some periodontal problems.
So you're saying that orthodontics can improve overall health?
It's important to have straight teeth. People see the mouth as a separate entity, but it's actually connected to our entire body. It's systemic. So any problems that we have in the mouth can lead to problems such as diabetes, cardiovascular problems, low-term weight babies, among many other issues. There are a lot of health problems that are associated with poor dental health.
I've seen an increasing number of adults with braces, and I'm sure you're aware of this trend as well.
Well, there's going to be a paradigm shift. A lot of these people have preconceived notions that orthodontics is just for children, but what we are seeing here are a lot more of these adults coming in where they weren't able to afford orthodontics as a child, or where maybe they're wanting to come in and improve their smile. It was something that they've never had done, or maybe they just weren't wearing their retainers and they've had some relapse, and so they're able to come in and I'm able to help them.
What kind of treatment options do these adults have?
We have many of them. Invisalign is going to be a very good option. Those are the clear trays that we take in and out. Some interesting things that we're doing here are the invisible braces, which are braces that are actually behind the teeth, and so those are truly invisible and hidden from the public.
How do you determine the level of treatment a patient will need?
That's a very good question. A lot of patients and parents come in asking, does my child need 2 phases of treatment? And really the best thing here is to come in for a consultation. Not every patient is going to be a candidate for phase one. But in phase one therapy, what I'm looking to do here is really to repair any sort of problems or issues that are going to lead to irreparable damage later down the line.
And you actually help patients prepare for surgery?
I do have some young children here that are ready for surgery with some surgical cases, and I'm excited to be able to prepare them for surgery. And they struggle with some self-esteem issues with the way that their jaw protrudes, and we're really looking forward to getting them into a situation where they're stable and ready for surgery.
What is the most rewarding part of orthodontic care?
It's really amazing that you forget how quickly where you started, and we're able to see their teeth and where they originally were and the finished product, which is always amazing. And we always get a kick and laugh out of possibly the fashion sense that they had back then, or the hairdos and things like that.
What are some of the aesthetic advantages of orthodontics?
When you do get orthodontic treatment, we're able to line up the teeth here, and certain positions of teeth are going to allow for a more aesthetic smile. They're going to look a little bit more polished and younger and vibrant, especially as we widen the smile. That's going to be something that patients really look for and see. That's what people consider to be aesthetic.
Some people may be considering orthodontic care but don't want to wear that retainer. What is your advice for somebody like that?
That's a tough one, because what I teach all my patients is retention is for life. There's nothing in our body that's going to be 100% static or permanent. We're always aging, maturing, and changing. Our skeletal structures and bone morphology is changing, and so our teeth are going to move along with it. What I do provide is fixed or permanent retainers here that's going to aid with that, but there is still going to be some responsibility here with some retainer wear.
Does orthodontics help a person to keep their natural teeth longer in life?
Oh, absolutely. A lot of times we talked about a malocclusion, meaning a bad bite, and a lot of times when there's a bad bite, we see teeth that are traumatically hitting together. They're not fitting together properly as they were intended to, and so a lot of times they're being worn down or fractured. And once you lose that tooth structure, that's irreversible. That's when they start having to go down the veneer route or some cosmetic buildups in order to restore that.
Would you like to add any other reasons why visitors should contact your office?
Other services I do here are going to be, we do TADs, which are temporary anchorage devices. These are things that are going to avoid surgical procedures if needed. I don't use headgear in the practice. Recent advances in orthodontics has allowed us to circumvent that and use other methodologies to get the same results as a headgear. And so there's a lot of things here. I like to keep up to date with the technologies so that we can better treat our patients.
Well, thank you for taking the time to talk to us.
Thank you. Thank you for having me.
That's Dr. Howard Choi of Choi Orthodontics.